Okay, everyone, let's get started. There might be a few people that'll log on a little late, but we'll go ahead and get started. So thank you for being on the call today. We're starting week 2 of our speaker series for the Future of Medicine program. So before we get started, I have a couple of reminders to make sure your full name is in your Zoom profile so that we can take attendance. Please be respectful and attentive of our speakers, staff, and your fellow students. We welcome you to have your cameras on. It's always nice to talk to faces instead of blank screens. Please keep yourself muted when not speaking. You can use the chat function to ask or answer questions. And if you'd like to speak, you can use the raise hand function and we'll call on you time permitting. So our first speaker is Tram Dow. Tram is a medical assistant at Sacramento Ear, Nose, and Throat. She has experience working with patients in different specialties, including emergency medicine, family medicine, geriatrics, and say that for me,
Otolaryngology.
otolaryngology. And she recently completed a pre-PA post-bac program at Tech Graduate Institute and is pursuing a career as a physician assistant. So welcome, Tram.
Thank you so much, Sam. I will take it over from here. Let me see if I can share my screen and show the Google slides that I made by chance. Let's find out. Okay, I guess I can do it this way. Can you guys see the slide?
Yes.
Okay, wonderful. Hi, guys. I'm Tram. Thank you, Sam, for that introduction. I'm so happy to be speaking with all of you guys here. I may have met some of you guys because I know that some of your classmates have shadowed me at the Folsom Sacramento Ear, Nose, and Throat location. But if I haven't met you yet, hello, guys. I'm going to be doing a PowerPoint slide today, but I just want to let you guys know if you have any questions, by all means, please just raise your hand or ask a question in the box because I don't want you guys to lose it if you do have any questions. So let's get started. Again, my name is Tram. I'm going to be talking about my healthcare journey to becoming a physician assistant. A little introduction about me, guys. I was born and raised in Sacramento, California. I went to undergrad school here. My current job, as Sam said, is that I'm a medical assistant at Sacramento Ear, Nose, and Throat. A little fun fact about me, I guess, to get to know me, guys, is that I love traveling to Southern California. I hope to practice medicine there one day. I love trying new matcha places, going to the gym, and scrolling through TikTok. So I don't know if a lot of you guys know or not, but kind of what is a PA? A PA is basically a licensed medical professional. They practice medicine under the supervision of a doctor, a physician. They pretty much do all the things that a physician can do, which is perform physical exams, they diagnose, they treat patients, they prescribe medicine, they order imaging, they order lab work, they can assist in surgery. So PAs can really do it pretty much all. There's nothing that I haven't seen in medicine that a PA can't do that a physician does, kind of in a sense. Why did I choose to become a PA? Now, actually, when I entered college, I actually wanted to do medical school. And it wasn't until I opened up like the MCAT book. For those of you who are kind of going pre-med, you guys know about the MCAT. It's an exam that you take before you apply to medical school. I thought I wanted to do that, but then I saw how lengthy that preparation was, and kind of realistically with my life goals, I didn't think that doing medical school would be best for me. So I kind of looked into other outlets and I found out what a PA does. So a PA, for those of you guys, again, who don't know, they have 2 years of schooling, which is where you get your master's of physician assistant studies. A cool perk about PAs that a lot of people don't know is that they can change specialties. So unlike physicians, they choose one specialty and they practice that pretty much their whole life. But as for PAs, you can work in more than one. So excuse me, a lot of the PAs that I've worked for have worked in more than 2 specialties. So for example, if you wanted to work with pediatric kids, pediatric populations, you can do that for 5 years. And then after, if you feel like, oh, maybe that's not the route for me, then PAs can go and work in emergency medicine after that. So as long as you have a physician who's willing to train you. Another cool thing that I noticed about PAs too is that they kind of have different levels of autonomy, which means that most PAs can work under, really closely alongside a physician, or they can work pretty independently. And luckily, I've kind of gotten to know both. The PAs here at Sacramento Ear, Nose, and Throat, they work pretty independently. They have their full load of patients. They don't really consult the physician unless they have really concerning questions, but otherwise, they're on their own. And then in emergency medicine, when I worked with a PA there, they work really closely with the physician because a lot of emergency cases will come through and they just kind of need that extra advice or kind of extra tip to figure out what's going on with the patient when they're coming in that urgently. So again, it all depends, but the reason why I chose PA is because the 2 years of school, although it is very intensive, it's not just 2 years of, fun and games. It's a really intense program from what I've heard. And yeah, that's pretty much why I chose to become a PA over kind of other routes in the healthcare field. Also, by the way, if you guys have any kind of medical school questions or dental school questions, I have friends and colleagues who are in both. So this is kind of all geared towards PA, but I want to let you guys know if you guys have other healthcare options that you're thinking about and you have questions on, I can definitely kind of talk about that a little bit too. Yeah. Any questions thus far? Sorry if I speak kind of fast. It's just something that I do. No questions, no hand raises. I don't see anything in the chat box either. Okay. Just flag me, wave your hand or anything, get my attention, and I'll definitely try to answer any questions if you guys have any. Education, just like you guys, I believe you guys are all in high school is what they told me. I went to high school at Consumnes Oaks High School in Elk Grove. I did my undergraduate degree at Sacramento State, like I said, born and raised here. I went to Keck Graduate Institute in Southern California and I did a post-bac there, specifically for PA school. And for those of you guys who don't know, a post-bac is pretty much just a GPA booster. A lot of the students in the post-bac with me were actually all pre-med students, and they kind of wanted that extra thing on their resume to get them into medical school. So the post-bac is not just for PA students, it's for medical students and dental school students too. And then in the fall of this year, I got accepted into the Master's of Physician Assistant Studies at A.T. Still University in Anamaria. So I will be going to PA school there for 2 years. Healthcare experience, guys, for PA schools especially. I also noticed that with medical students, pre-med students too, they require a lot of like patient care hours and healthcare experience. And this is just a list of things that I've done. I've done UC Davis PICU hospital volunteer. For you guys who are in like Folsom, Sacramento, UC Davis is a really good opportunity for volunteering. They contract you for like a 6 month, 5 hours a week. It's pretty easy. So if you're not doing anything that's just something that you can add onto your resume. They love volunteer hours. In the hospital, I was a certified nursing assistant, also known as a CNA. I've been a medical scribe, which I really enjoy. I've been a medical assistant, which I'm currently doing now. I've been a pharmacy assistant. I've helped kind of not fill meds, but I help organize medications and help patients in that way. I've been a program director of an adult day healthcare center, and I've also shadowed physician assistants, which again, shadowing whatever healthcare experience that you're in, shadowing is going to be a #1 thing. You always want to shadow if you have time because you want to know what you're getting into. So I really, really suggest if a healthcare experience, especially for high school students to start off, is to just shadow. See what PAs do in a day, see what medical doctors do in a day, see what nurse practitioners do in a day if you're interested in that. Or if you're interested in like ultrasound tech, you guys should definitely shadow. And if you can just shadow them for a day for like 8 hours, I think it'd really give you a good basis of what you're getting into and kind of what you're working towards. Out of all of my healthcare experience, the only one that required a certification was the CNA license that I had. I know that a lot of you guys may or may not know, but like medical assistants, you can get a certification, but if you're lucky like me, you can just join a healthcare practice and they'll teach you and they'll train you. So you don't always need a license to do certain things as long as the healthcare facility is willing to train you. Any questions? Nothing? Okay. Types of specialties I worked in, like Sam said, I've worked in family medicine, like a private practice family medicine with a doctor and a pharmacist. I've worked with geriatric populations. I've worked a lot of populations with like mentally disabled, like cognitively disabled individuals too. I've worked in emergency medicine. Not my favorite of all the specialties, but if you're an emergency medicine kind of person, good for you. It's going to be a fun field. I think it's just very chaotic in emergency medicine sometimes because you're seeing patients of all sorts of things. And then obviously I work in ENT right now, also known as otolaryngology. Um, so yeah, I hope to work in more specialties though. These are just four out of the very many that PAs can work in. Similar to physicians too and nurse practitioners, they can also work in these same fields as well. So here's a PA school checklist. I tried to sum it up for you guys, for those of you guys who are interested in this route. You guys will obviously, you have to go to college, you have to get your 4-year degree, get your bachelor's degree. You have to do prerequisite coursework for PA school, things like OChem that you'll take in college, things like biochemistry, physiology, anatomy. Those are all prerequisite courses that PA schools, medical schools, and dental schools require too. Um, so yeah, for your bachelor's degree too, I did mine in biomedical sciences, but you guys actually do not have to do something science related. If that's although healthcare is all science related mainly, you can do like a bachelor's degree in English, you can get a bachelor's degree in politics, you can get a bachelor's degree in nutrition. You don't necessarily have to do the biomedical sciences route that a lot of students do. So as long as you do the prerequisite coursework with that. Another PA school checklist that I wish someone would have told me before is that GPA matters in college. I know a lot of you guys are going to come in pre-health, pre-med, things like that, and you'll hear your colleagues say that Cs get degrees. But in healthcare and in pre-med, Cs do not get you degrees. I can promise you that. You guys have to maintain a very, very good GPA. Not only your overall, but your science GPA will matter a lot for PA schools, med schools, nursing school, things like that. You'll need patient care experience, like I told you guys, become an MA, CNA, medical scribe, EMT. Those are all hands-on patient care experience. Same with healthcare experience and shadowing hours. You guys will also need that as well. They love volunteering. You don't necessarily need to volunteer in the hospital either. You guys can volunteer in whatever interests you, whatever you guys are passionate about. PA schools, medical schools, again, all the schools, they all want to see some uniqueness about you guys because you have to think about it. You guys are just one of thousands of other applicants who are also applying to hopefully, graduate school, things like that. So you kind of want to stand out a little bit and make your story a little bit more unique if you can. So that's also kind of my advice to you guys as well. You'll need letters of recommendation. So when you guys go to college, all you really need is one good professor who can write a letter of recommendation for you. So be close with the professors that you're in college. It's not only just going to help you get a letter of recommendation, but it's going to help you in your classes, especially like OChem, some of the math courses that I had to take, physics. If you're closer with your professors, it's a good thing because they're going to help you out with exams and things like that in your studying techniques. You'll need a personal statement, which again, your personal statement is just a story about yourself and why you chose the route that you chose to begin with. You'll submit all of this information to CASPA, which is a PA school portal. You'll answer some supplemental questions for some of the schools. You'll interview with some of the schools that want you back, and then hopefully after that you're accepted and you head off to PA school or med school or wherever you guys are interested in. Questions, if you guys have any at all? I kind of want to know too, like, if you guys can, just insert in the chat box what you guys are kind of interested in healthcare wise. If you guys want me to touch up on a topic, I can try my best because again, I have a lot of friends and colleagues who are in different schools than I am right now.
Can you talk a little bit about the MA Scribe? So what a Scribe does and what you do specifically as a medical assistant right now?
Oh yeah, awesome. I can definitely do that. I don't know what happened to my screen. Oh, there we go. Yeah, so a medical scribe, so that's the position that I told you guys I liked the most. Out of all of the positions in healthcare that I've worked, I liked medical scribe the most because you're alongside the physician in the rooms with the patient, and you're pretty much writing down what the physician tells you or what a PA tells you or what the nurse practitioner tells you, and you're also writing down what the patient is telling you. You're writing down their history, their story, why they're coming to the office to begin with, and you're just pretty much a typist next to them. You're also helping to stage like medications, imaging orders. So I felt like that experience out of all really gets you into the feel of what you'll be doing in the long term, which is working with patients. you're seeing, their physical exams, you're participating in their care. In addition to that, medical assistant was also, I have a question, I'll answer that one too. A medical assistant is different than a scribe because you're kind of handling more of the back office end questions. So as a medical assistant, my day-to-day right now looks like I am rooming the patients for the provider. The provider could be anyone. Again, it could be a PA, it could be a physician, it could be a nurse practitioner. I'm rooming patients, I'm getting their story, and then I'm out of there. And then on the backhand, I'm handling questions for the provider. I'm handling questions that come through the line, such as I just had surgery. Should I be doing this, or that? And I'll kind of answer questions on the back end. I'll handle referrals. I'll clean up instruments. I'll set up surgical trays because here at the specialty office, we do a lot more in-office procedures. So that's a really fun and cool experience. If you're going to medical assist, I definitely feel like a specialty would be something cool to get into because you kind of get to see more hands-on things that you'll do hopefully in future. Yeah. Hopefully that summed it up, Sam, for the medical assistant versus scribe kind of thing. Okay, I have two questions in here. I'll do the first one. What was the biggest challenge during your time studying for PA? My biggest challenge for myself, and again, this is not for everyone, for myself, it was my GPA actually. So in undergrad, for those of you guys who are going to be going to college very soon, undergrad science courses were very difficult. And again, I wish I would have asked more questions and gotten closer to the professor or at least the TA that's helping with your college course. Because if you don't have a good science GPA, you'll have to make up for that later. And you don't want to do that. You guys all have a fresh start right now. So in the more harder classes, again, like I think physio was a pretty intensive course. Biochem was definitely a challenging course. OChem were challenging courses in undergrad for me. Although it's been quite a while still, I still remember those courses, try your best to just really understand the material and get close with your professors, go to those office hours. I know that in high school you guys can have that, but in college, those office hours really make a difference. So if you're struggling in a course, find out what your strengths and weaknesses are first and kind of get a better handle on that. Because even though you may be getting really good grades in high school, which is fantastic, in college, it's a little bit different because some of those courses can be challenging. Sometimes maybe they're not as challenging. So it just depends. But for me, it was my GPA. And that's exactly why I did my post-bac after college. It's to help with my GPA. Which classes were the hardest to complete? Oh, I think I went over that a little bit too. Again, that was just me personal. I don't know what your guys' chemistry, rating is, but if you're doing good in chemistry, those were my toughest courses in undergrad, for sure. I'm definitely interested in PA or pediatrician. I was wondering, how do you stay up to date on new medical information and treatments? So as a medical assistant, I guess if I'm wanting to know more about my field specifically, there's a PA website called it's called the AAPA. It's like the American Medical Associates of like Physician Assistants or something. So I keep up to date on there. But luckily, actually, two of my closest friends, one is already graduated from PA school. The other one is finishing up her second year now. They actually inform me a lot more better. So the connections that I've made thus far are what keep me up to date, especially on new medical information. I don't do a lot of treatment or I don't treat patients right now because I do medical assisting work. But when I do become a PA, there's a lot of research information and outlets that PAs use. Same with doctors too. The doctor that I work for right now, she also keeps up to date on research through forgot what that one site is called. I know you guys have had access to it though. When you're wanting to look for like peer-reviewed science-related research, you can go on that portal and kind of keep up to date with things. So yeah, but pretty cool that you're interested in doing PA or maybe becoming a pediatrician. Those are awesome routes to take. How was your experience as volunteer in foreshadowing? Oh, volunteering at UC Davis again, guys. If you guys are close to the Sacramento location, I think they're opening one up here in Folsom too. UC Davis is a really cool place to volunteer. They're very, very kind. You do have to wear a uniform though. The last time I wore a uniform, I had to wear a very bright yellow shirt. So that'll be fun. Shadowing was also a good time. Luckily, if you want to shadow a doctor or you want to shadow a PA, You guys have to be a little bit confident. You guys really have to not take no for an answer because a lot of these times, these providers in healthcare, they're very busy. So if you're not standing up for yourself and, saying that, please, will you let me shadow? Like, if you're not making that extra effort, they're not going to make that extra effort. So if you want to shadow somebody, really, definitely print them out your resume maybe and start off with that and just say, I'm really interested in your career. If I could just shadow for 8 hours today, I promise I'll be like a fly on the wall, things like that. Sometimes gifts go a long way too. If you just want to bring, like a nice little box of chocolates or maybe some flowers and just say, hey, like, I really want to shadow you. If I could, that'd be amazing. So kind of small things like that are what get you an opportunity to shadow, for say like a physician, a nurse practitioner, or PA. How did you find people to shadow during college? Is there any way to find more people willing to accept shadowing requests? I know. So shadowing is pretty difficult. I know that's a number one question too. Luckily, you guys kind of have a connection here to Sacramento ear, nose, and throat because that's where some of your guys' classmates ended up shadowing. So opportunities like this, Sam, are they able to take on these opportunities to shadow us, right?
So they applied to the program, and unfortunately, we don't have enough slots for shadowing. But I keep in
Mhm.
touch with all of them,
Yeah.
and so as shadowing opportunities, I've been able to find locations. So for all you students on the call, I do keep in touch with you, and if I can find additional shadowing, I certainly will enroll you in that.
Yeah,
But
see,
yes,
that's awesome.
you can go out on your own too. But
Yeah,
yes, through our program, we do our best to match as many as possible.
that's awesome, guys. See, like Sam, for example, she's here to help you guys. In addition to that, I know many of you guys have a pediatrician still since you're under 18, or maybe you guys already have your primary care physician. You guys should ask them. That'd be a perfect place to start. If you guys have any family, friends, again, this is where making connections kind of make a huge difference. If any of your friends are healthcare, friends' parents are healthcare providers, and try to reach out to them. And again, it's just 8 hours if you're like, it's just a Saturday. If you can just spend one Saturday seeing what a dentist does, seeing what a PA does. I think it's really worth your time to see what you'll be getting into. Um, you mentioned we can volunteer in Sacramento. How can we apply for those? All of this, the volunteering hours are online. So I know Sacramento actually has a ton of opportunities. I don't know what the age range is, but I believe most of you guys will hit the mark or the limit. So Sacramento, Elk Grove, I don't know too much about Folsom because again, I'm more Sacramento based, but a lot of the homeless shelters, a lot of the food banks, they all need volunteers. And if you guys just give them a call when you have time, primarily like on a Saturday or Sunday, just give them a call. Maybe during the weekday too, try a Friday morning. That'd be a best time to call a facility that's open 5 days a week. But if you Google right now, and I know many of you guys have Chat GPT, if you just put it in Chat GPT, find me some volunteer opportunities near my house, I'm pretty sure a few will pop up. And again, it's up to you guys to take full control of your healthcare journey, just like I did. I went out of my ways to apply to these jobs, to get these opportunities. And if doors opened up for me, I really just took them. I tried not to be afraid because even like, for example, emergency medicine, I kind of knew when I applied for the job that emergency medicine wasn't going to be for me, but how else would I have known that if I didn't go into the field myself? So I actually ended up being a medical scribe in the emergency room. And I'm so happy I took on that opportunity because you really don't know what to expect from each specialty until you get yourself into it. So my suggestion to you guys right now is, prioritize school is always going to be number one. So your GPA is the most important out of all the things. Everything else is if you have the capability and free time, which you'll have more time later on. But GPA is most important because GPA is what's going to get you into these programs. So prioritize your studying. And then when you have time, shadow, volunteer, things like that. And if you have time for a job too on the side, that's great. Do that too. Yeah. Just to raise a hand, how many of you guys are seniors or juniors?
They should all be.
They should all be. Oh, okay,
Mm-hmm.
wonderful. So you guys are all gearing your way into college already, which is great. So all of the advice now, yeah, I'm still going to stick to that. It's to prioritize your studying. Your first and second year of college, depending on where you guys are at, I think that'd be a better time to do more shadowing and volunteering because towards your junior and senior year of college, you guys are definitely kind of prioritizing more upper division classes, which can be a little bit challenging. But There'll be clubs on campus. Join those college clubs, those pre-healthcare clubs. Those give you so many opportunities to shadow and volunteer too. So, for any college that you guys attend, any of the CSUs or the UCs, that those first 3 weeks of campus, they'll have booths lined up across the campus for you to join, like a pre-dental club, a pre-PA club, pre-health club, things like that. And those you only have like a once a month meeting, and all they really do is give you information for yourself to gain more experience. So yeah, good
What
luck to those.
I had a question real quick. What schooling do you need for medical assistant and for scribe?
Oh, so for medical scribe, I actually didn't do any prior schooling. The healthcare facility that I worked at trained me, which is awesome. And then, yeah, from there, I took on more medical scribe jobs because I had the experience. So all you guys really need is that one healthcare facility who's willing to train you. As for medical assisting, a lot of my colleagues here at Folsom Sacramento Ear, Nose, and Throat, they actually have their certification. I do not. Again, I gained my experience by just coming to a healthcare facility, applying to the job, and telling them about my healthcare experience and background. And most of the time, they're willing to train you without certification. Many certified MAs, though, I think their schooling is anywhere from 6 months to a year, which I didn't have the time for. So I found a place that was willing to train me instead. To become a certified nursing assistant or an EMT, those programs typically take about a month and a half. You have to pass a certification through American Heart Association for CNA at least. And med schools, they love to see that. PA schools love to see that you're certified in something because you did a training for a program. But those are only a month and a half. So, you guys could do that over the summer, take a course. It is kind of expensive too, though. So it's about the last time I paid for a course is about $1,000, give or take. So if you guys have the financials for that, that's great. If not, that's okay. Why don't you guys do volunteering and shadowing if financials aren't in the question? That's fine too. Yeah.
Okay, are there any other questions for Tram?
Again, not just PA. I can do anything. Med school. I have friends who are dentists now. Pharmacy questions. I have a friend who was in the pharmacy program when I was in my post-bac.
All right.
Yeah.
I
I'll
don't see any additional questions. Sorry, go ahead.
No, it's okay. I'll drop my contact information in the box here, my email and my personal cell. Email is better for me, guys, but if you guys want to text, that's fine too. If I don't get back to you guys in a timely manner, please just double text me. I don't really care because I want to make sure you guys' questions get heard. So, yeah. Good luck to all of you guys, though, juniors and seniors. Congratulations. You guys are almost on your way to college, which is so exciting. Yeah, that's awesome.
Well, thank you so much for being on the call and sharing your experience with us. We really appreciate it.
Of course. You guys have a
All
great day. Thank you so much. Thanks,
right.
Sam. You're so
Thanks.
helpful too. Thank you, guys.
All right, everyone. We're going to take just a couple minute a break, so you can be back here in about 3 or 4 minutes, and we'll get started about 5 after. Okay. So next we're going to hear from Dr. Heather Thompson. She's a licensed speech language pathologist, professor and department chair of the Department of Communication Sciences and Disorders at California State University, Sacramento. She holds a language, speech, and hearing services credential and provides services as a speech language pathologist at Sacramento City Unified School District and Shriners Children's Hospital, Northern California. So welcome, Dr. Thompson.
Hi, thank you so much. It's so good to have the chance to meet with you all today. I do have a presentation to share. I'm going to start with right here. And I'm hoping that I can get my slideshow going in 1 second. All right. So I want to just welcome you to our department information session. So this is information about speech language pathology and audiology. I've been asked to come here today to talk to you a little bit about speech pathology and audiology and what it is as a profession. So that's my goal for today. So I'm going to skip some of these slides and get right to it. I have a little story for you all though. And it's my understanding, are you all high school students? Is this correct? Yeah, awesome. That's so good to see you all. So are you all seniors or are you all at different grades in school?
They're juniors and seniors.
Awesome. It's so good. So you're getting ready to graduate really soon, or you have just a short amount of time left in high school before you move to college. So this is perfect timing for all of you. So I learned about the field of speech language pathology. Actually, while I was actually a sophomore student in college at the time that I learned about it. So it was a little bit later than all of you. I was thinking about becoming a teacher, and I knew from the time I was 12 years old that I wanted to be a teacher. I did a psychology course called Psychology of Education when I was in college, and they placed me to work in a classroom. And I was placed originally in a grade 6 classroom, and I was to teach math, and I was also to teach language and a certain other subjects. And I found that managing a full classroom was really challenging and didn't quite fit my interest area as much as when I would pull students individually to work with students on smaller projects. And it was at that time that I learned about speech pathology. They said, oh, we can't hire enough speech pathologists. And at the time, I was like, oh, this is really interesting. I want to work with kids with special needs. I really like working individually, one-on-one with students. But most importantly, I knew that I wanted to get a job that would allow me to earn a really good salary, to have a really good flexible schedule, but where I could also be in education and healthcare. And so speech pathology and audiology checked all of those boxes for me. My mom wanted me to be an optometrist. She wanted me to go to optometry school. And because she felt like having a doctorate was a really good idea. And I was less interested in the ears and the eyes as I was about talking and listening. So that's what kind of brought me to speech pathology. So when I found out that they couldn't hire enough speech pathologists to work with kids on the autism spectrum, it got to be very interesting to me. So I started off in an early language classroom teaching little kids how to talk. And then I learned that speech pathology is a lot more than just teaching little children how to speak. It's also about helping people after they've had a head injury or a stroke or have gotten in a car accident. It is also about helping people after they have a degenerative condition diagnosis. It's also about helping people who have cancer and they might have a head and neck tumor that they need surgery on. And then afterwards, after the surgery, they need some rehabilitation and they need to learn how to regain the ability to talk, listen, and also swallow. In speech pathology, because the same mechanism that's used for speech is also used for swallowing. We're the healthcare professional that helps people after an injury regain their ability to eat food by mouth. Because there's a lot of people out there who've had head injury that they can't take food orally, they need to eat through a tube. And that's not a very fun situation to eat through a tube. Because people like to go out to restaurants and they like to have dinner with their families. And if they have to eat by a tube, that's not so fun. And so we want to help people be able to regain their ability to eat and take food and drinks in a way that they want and eat the things that they want to eat as soon as possible. So that's a big part of my job that I do is help people with mostly with tumors and regaining that ability. Okay, so what about audiologists? Who are audiologists? So audiologists help people with hearing and balance concerns. So because the same mechanism in your ear, not only does it help you to hear and listen and process information, it also helps with, because of the semicircle canals, the anatomy in your ear, it also helps keep you upright and have balance so that you don't get nauseous, so that you don't fall over or pass out when you have a hearing related concern. So they help with ear problems. So audiologists work with people from newborns all the way through to older adults. They help by performing hearing evaluations. They fit hearing aids, assistive cochlear implants, which are implantable devices and technology. So a surgically implanted cochlear implant. We help with, the audiologist will turn the implants on and help people have a programmed implant that works with the hearing that they need. They'll also help with monitoring the auditory system during surgery. Audiologists help design hearing conservation programs, and they do infant and newborn hearing screening to make sure that babies who are brand new, less than a day old, have their hearing tested so that they can make sure they're not born deaf or have a hearing problem. And then audiologists work in schools, they work in hospitals, they work in private practice. You can own your own clinic. They work in the military, and they also work in research hospitals. So there's a lot of different job opportunities for audiologists. Audiologists do assessment and treatment of auditory processing disorders and hearing concerns. They help with something called tinnitus, which is ringing of the ear. Like if you get a buzz, has anybody listened to loud music and then you get ringing in your ear after you go to a concert or hear loud music? Or if you have your music turned up too loud? That's called tinnitus. And that ringing of the ear is a sign that the cells in your ear are permanently dying. Every time your ears ring, those little hair cells are dying and they never come back and you can't regain them. So sometimes people have what's called noise-induced hearing loss, where they've lost their hearing because they listened to music that was too loud and now they need a hearing aid or other implantable device or technology. And so an audiologist will also fit and dispense hearing aids, and they do hearing conservation programs and hearing rehabilitation programs. And then, like I mentioned before, they do newborn hearing screenings. So there's lots of fun things that happen with newborn babies all the way through older adults with hearing healthcare. Okay, so what do you need to do to become an audiologist? So there's a lot of reasons to become an audiologist. Not only is it really fun and it's healthcare and also education, um, you get a great salary. You'll make like $120,000 a year, which is a really good salary this day and age. It does require you to do a college degree, and then you have to do what's called an AUD, the Doctorate of Audiology. So you're a doctor at the end of it, and it takes 4 years of college plus 4 years of the doctoral program. And then when you're done that, 8 years, then you go on to become an audiologist. So you're going to become, you're going to turn 27 anyway. So you may as well, when you're 27, you may as well have a doctoral degree when you're done, right? Okay. So if you're interested in audiology, you can email myself or you can email Dr. Laura Gata, and I'll put information in the chat at the end, and we can help you figure out what questions you have to know if you're interested in audiology. And I can tell you right now that we need more audiology students. There's going to be a need for this job as you go forward. We need 750 more audiologists in California alone by 2030 to just meet the need of our current California population. So we need you. And so if you're interested in this area, I highly recommend and would love to meet you to answer questions that you have about it. Does anybody have questions about audiology right now before we move on? I'm going to stop my screen for a second and just see all of your faces. Anyone have questions about audiology? Okay, all right. I'm going to show some videos at the end if I can. Okay, speech pathologist, that's the next thing. And this is what I do as a speech pathologist. I've been a speech pathologist for like almost 20 years now. And speech pathologists, we are responsible for providing assessments in the area of speech, language, and swallowing. Another thing called cognitive communication. And we work with people through infancy all the way through older adult years. And we have to do assessments. It's super cool. So let's say a person speaks 3 different languages. We have to do an assessment in all of the languages that a person speaks, and make sure that they don't have concerns with learning language in general. We need to identify, do they have problems learning language? And if so, then we provide them with therapy to help with their language skills. It's not just about teaching little kids how to talk. It's also about working with older adults. But I work in the schools. I work with kindergarten through 2nd grade students and preschoolers. So that's what I do in my school days. I help kids with special needs who have disabilities. I help them with their speech and language skill development. And then I also help if people are nonverbal, like say a person has autism and they can't communicate verbally. I'll help them with their augmentative alternative communication device, like using an iPad talker that's called a speech generating device. And so it's using technology to help people communicate if they can't use their mouth to communicate. And then I also, like in a hospital setting, what I would do is do an assessment. Like I would do an X-ray or what's called video fluoroscopy with a radiologist to look at a person's swallowing ability. And so we have people drink and eat different foods of different textures, and we put the special medicine in it called barium. And what that barium does is it mixes in with the food that the person then eats, and then it lights up on an X-ray or on what's called video fluoroscopy. So we do that imaging in the hospital, and then when we can see if the food is going into the esophagus down to the stomach, or we can see if the food is going into the airway, and that's a problem. And so if the person's taking food into their airway, we would say, okay, they can't take food by mouth because it's not safe for them to swallow. And so what we would do instead is we'd recommend that they eat through a tube for a while until we figured out what the problem was and until they get the therapy that they need to help them swallow. Or we would say, you know, you have to do this strategy, like you have to tilt your head or turn your head or tuck your chin or do some other strategy to help you swallow safely so you don't take food into your lungs. Because some people after a head injury or a stroke, they have difficulty even feeling if food is going down the wrong tube. They won't cough afterwards, but food will go into their lungs, and that's a problem. Okay, so we also help with people with accent modification. We provide strategies for people with autism. We help with stuttering. So if people have a stutter, we help them become more fluent or develop strategies to be okay with disfluency. We do language-based reading disability services to help people with reading. We help people with neurological disorders in a hospital setting. We work in acute care or outpatient rehab. And then I also help people with cochlear implants, swallowing, speech and language disorders, or problems with their quality of voice. So some people get hoarse because they have other problems going on. And so they get hoarse and the hoarseness doesn't go away. It's not just like, you know, you feel hoarse because you've got a cold. Some people have hoarseness that lasts and lasts and lasts. And so we help them with talking in a way that doesn't injure their voice. So we work in schools, we work in medical facilities like hospitals and rehabilitation centers and home health and skilled nursing facilities. And we also work in private practice, so you can own your own practice just like a medical doctor. And there's a lot of different opportunities. So if you're interested in speech pathology, you can reach out to our grad coordinator, Dr. Haggie, or you can email me as well, and I can answer any questions that you might have about speech pathology. And then what do you need to do? So here's the next step. So to become a speech pathologist or an audiologist, a speech pathologist, you do a 4-year college degree in communication sciences and disorders. And then you have to go to graduate school, and that's a 2-year program. So in 6 years, you can get a master's of science in communication sciences and disorders and become a speech pathologist. And it's well worth it. Those 6 years, it sounds like a long time, but it'll just fly by. And before you know it, you'll be a fully employed adult getting a really good salary. Again, that salary is going to be about $100,000 to $120,000 a year. And so it's a very good salary, in my opinion. I've had a really good life. And it allows you to do things like get the things that you need, take care of yourself, and provide for a family and buy a house and all of those good things. Okay, so what do you do to become a speech pathologist? We have an orientation that we run every summer. So if you want to drop in and learn more about it, you can come to our orientation. We have major group advising as well. So as you apply to college, you can apply to the major of speech pathology. You can also go to the junior college for the first 2 years and go to like Sierra or San Joaquin Delta or ARC, American River College, or Sac City Community College. And you can do the first 2 years over there, and then you can transfer to Sac State into your junior year, and then you do 2 years of college in junior year, and then you finish your degree in communication disorders. So we can also help with that. And let me tell you what we do. So we offer a bachelor's degree in communication sciences and disorders. We also offer a second bachelor's degree for students who have a bachelor's degree in something else. And then we offer the master's in communication sciences and disorders, and that's what you need to be a speech pathologist. And then we offer a doctorate of audiology program. And so we're really looking for students who are interested in applying to graduate school because it's just such a great profession and great field. Okay, so what do you do in undergrad? Okay, so you have to start off in your freshman or sophomore year of college, and you have to take 4 courses to be able to major in communication disorders. You have to take a course in human development through the lifespan. You have to take a course in Introduction to Statistics, an Introduction to Psychology course, and then you need 1 course in Introduction to American Sign Language. So you need those 4 courses sometime in your freshman or sophomore year. And you can take them at the JC, or you can take them like over at the junior college and transfer it in, or you can take it at Sac State as well. And then we just help you move forward. And then our courses start when you're in junior year. Okay. So then in junior year, I'm going to just pass forward here. Then you would take, oops, sorry about that. I'm opening up some other screens. Then you would take 4 courses in junior year. You would take the physics of sound and phonetics. You would take anatomy and physiology of the speech mechanism. You would take CSAD 112, which is language science and development, and then you would take an introduction to audiology course. And this is for the bachelor's degree in communication sciences and disorders. And then you would take a course in developmental and acquired neurogenic language disorders across the lifespan. So this is like your head injury, degenerative disorder like Parkinson's or multiple sclerosis. We teach you all about Alzheimer's. We teach you about a lot of like older adult conditions. You would also take speech sound development and disorders in children, 126, and then you do a course in supervised observations in the clinic. Then you take a research course called Research in Speech Pathology and Audiology. And then in senior year, you take more advanced coursework in voice and autism, neurodevelopmental disabilities, assessment procedures, and then you start in clinic. And we help you to learn about clinic and clinical care for patient populations. And then in spring semester senior year, you take a course called Introduction to Oral Rehab, where you help with people who are deaf and hard of hearing learn to speak. You also do a course called Medical Speech Pathology, which is very much hospital-based medical. So if you're interested in healthcare, this is a great profession to get into. We teach a 133 course. You'll take a course called Communication Disorders in Multicultural Populations. And this is to learn how to provide care to people who speak more than one language, which is really important in speech language pathology. We have to be able to do this really well. And then if you didn't take the Introduction to Clinical Methods in this fall semester of senior year, then you would take it in spring. And there's some caveats around some of the classes that you take, but we'll help you figure every course out. And everybody takes the same courses in at the same time, and it's in a cohort. So you get to know about 100 other people who have the same courses that you have. And so there's lots of support, and you'll make a lot of really nice friends. And it's a really great profession to get into because we all know each other, and we're all we're hardworking healthcare and education providers. So I'm going to stop my share right there and see if anybody has questions about speech pathology. Anybody have questions so far? And you can put it in the chat.
Quiet this morning.
Yeah, please go ahead.
Do you work closely with the deaf community?
Yeah, we do. So the work that I do specifically as a professor in speech pathology is I provide care to people who have something called neurofibromatosis related schwannomatosis, and that is a mouthful. And basically what I do is I work with patients who have head and neck tumors, and the tumor gets so big that it causes people to become deaf, either on one side or both sides, so they become completely deaf. And neurofibromatosis type 2 usually happens when people are in their early 20s. They start to go deaf. So everything is developing normally. People are learning speech and language, and then all of a sudden they wake up one day and they have trouble hearing. And then they usually get an X-ray or an MRI, and they talk to their doctor, they get referred for that imaging, and then they find out that they've got this tumor, and then they don't know what to do. And so this is where I help a lot of people who are deaf and hard of hearing. So that's a great question. Other questions that you might have? Yeah, I work with neurologists every week. That is such a great question I see in the chat. How is this similar to neurology, and how do you collaborate with neurologists? Yeah, so it is really similar to neurology in that you do a lot of neuroanatomy and you learn a lot about, we do something called cognitive communication. So what happens is the neurologist will do, so a patient will have a stroke or a head injury or something that is neurologically based. And then the neurologist will see the patient and they'll say, let's get some tests done. And then they'll send the patient for the tests. And then the tests come back and the neurologist says, yep, you have a brain lesion and you have multiple sclerosis. And that is why you're having difficulty talking and walking. So now, because you're having difficulty talking, I'm going to send you over to my colleague in speech pathology and they're going to help you. And so then we would work with neurology and we would work with the patient. And the neurologist does all the evaluations and says, yep, you have a problem. And they diagnose. And then we do all the care. Like, how are you going to regain functioning? So I work with neurologists every week to help with the patients that they're seeing that they've diagnosed with having concerns. So we don't do the diagnosis of the neurological condition, but we do the diagnosis for all of the stuff that follows up from a neurological condition. So I help with like treatment planning. I help with with reports. I help with, I'm responsible for doing diagnostics. I recommend additional imaging. I make other referrals for patients with their neurologically based concerns. I provide a whole treatment plan for people with neurologically based concerns. So it's a very exciting, it's a very demanding job. It's a very rewarding job. It requires a lot of education and training and a lot of knowledge of healthcare. But it's such a great, speech pathology is an awesome profession if you're interested in neurology. We do memory care. We help with grandmas and grandpas who have difficulty with memory because we have a whole bunch of strategies in speech pathology on how to help with memory. So it's super fun that way too. One more question and then I'm going to show a quick 2-minute video.
They have one in the chat. How much work do you do per week?
Oh, that's a great question. As much or as little as you want. So if you have a full-time job, you're working, okay, full-time job at the school district is 6 hours a day, 5 days a week. So 30 hours a week. Plus then you've got a little bit of paperwork after the kids go home. If you're full-time in the hospital, you're 40 hours a week. But I love my job so much. I have a full-time job as department chair at Sac State. I have a part-time job in the hospital at Shriners. And then I have a part-time job in the school district. And so I choose to work 52 hours a week because I love it. So I love it. I love it, love it, love it. And the salary is great. I get to see a lot of patients. I help 48 kids a year, plus all my caseload at the hospital. I love my job so much. But you could work part-time if you wanted. Or a 0.2, like 1 day a week, whatever you want, really. Okay. Whatever makes your heart happy is how much you work. Should I show the 2-minute video?
Yeah.
Okay, very good. So here is, let me see if I can actually pull it up. Okay. I'm going to just do a screen share now. Sorry, now that I got it set up.
Yay. Papa, my body lies over the ocean. It's supposed to be a suffix. Yeah. It's because we're going to do you like it better like this or like that? It's helping a stroke patients. She used to be an architect.
Community members come to our facility to receive services for a variety of reasons. They might seek clinical services for speech and language impairments, or for people who stutter, or voice therapy.
Speech, yes, it's helping, yeah, communicate better. Miracle.
I work with Carroll. It's just so beautiful, the friendship that we bond over the weeks. And the reason I wanted to get involved in this is because I knew that it was such a renowned program.
Art is a means by which our students work with the individuals to support their overall communication.
Art, yay, right where we are.
Singing is often easier than speaking for individuals with a motor speech disorder. Not only therapeutic, but it's fun.
All done. More? Perfect. With the kiddos, it's basically a lot of play and getting to know them, getting them comfortable. My daughter has a expressive speech issue, so she's not hitting her milestones for expressive speech. So we're just trying to get her to speak more. We basically just play and have fun and encourage her to express herself. Okay, later. So it's a month in, and she's speaking a lot more. Sacramento State has been phenomenal. I've actually recommended Sac State to like 4 other parents.
Our clients don't pay. We don't have a fee for service. We are a donations only clinic.
This is kind of their last hope. Their insurance isn't covering any services. The fact that now it is based on donation and it's literally what our family can afford, then I mean, I'm just super thankful that has been it. So thank you to all of those that have donated for the cause. Thank you. There's a lot of tears.
Okay. All right. Hopefully you were able to see that video okay and it worked and it wasn't blurry and you could hear the audio okay.
Yeah, it looked good.
Excellent. All right. So I know I'm over time, but I'm going to put my contact information in the chat and you all can email me if you have any questions. And so that is me. If you're interested in audiology and in learning more about the audiology program, please reach out to Dr. Laura Gaeta, and I'll put her information in the chat as well. Her name is Dr. Laura Gaeta, and she's our audiology program director. She's so smart and she can answer all your questions. She's really kind and approachable, and she would love to talk to you. And then if you're interested in coming to our grad program and asking more about what it is to apply to graduate school, please reach out to Dr. Darla Hagee. And Dr. Hagee also will answer your email right away. And she is off for the summer, but she's really good about replying if you tell her you're a high school student and you're interested in going to the grad program. And she'll help you as well. And then please email me as well. And you can also CC me on the emails that you send to the other faculty as well, because I want to support you and make sure that you get everything you need to be super successful as you go through. So just a show of hands, how many people, I know I'm over time, how many people might be interested in this or learning more? How many of you think this sounds kind of cool? Yay! Awesome, Daniela. All right. Awesome, Mahmoud. Good to see you. Thank you so much. And Alina and Tram. Awesome. That's so cool. I know that as soon as I learned about it, it changed my life, and I'm really excited to have been able to work in this profession for almost 20 years. So, okay, everybody, thanks so much for your time today.
Thank you.
Yeah.
Thank you very much. Have a great afternoon.
Awesome. You too. Take care. Okay. Bye.
All right, we're going to go into our next speaker. So Dr. Christie Carroll is a dermatologist with the Woodland Clinic Medical Group. She's been with Woodland since 2007. She also works as the Chief Experience Officer for Clinician Experience, working on wellness within the clinicians in her medical group. So welcome, Dr. Carroll.
Hi, everyone. Good morning. Nice to see so many people that are interested in medicine. We need all of you. I didn't really prepare anything per se, so please interrupt with questions. I will just start with a little bit of my background so that you kind of know where I came from and potentially some of the choices I made and why I kind of feel like I fell into dermatology. So I actually grew up in Sacramento. Many years ago, I was actually an SSVMS on a scholarship recipient in college. So that was a long time ago. But I went to Davis for UC Davis for undergraduate and then UC Davis for medical school. I did my residency. I did my intern year out in in San Diego in internal medicine. And then I actually was not a successful match candidate when I went into residency. I did not get into dermatology when I first applied. And so then I did 2 years of research out at Wake Forest, and then I ended up matching at Wake Forest for dermatology. So I did through basically 5 years out in North Carolina, 2 years of clinical research, and then 3 years of dermatology residency. I, again, was from this area and wanted to come back home. All my family was out here, so I looked for jobs back this way and landed at the Woodland Clinic Medical Group and have been here ever since. So I am the dermatologist that has been around 18 years this summer. So it seems like I wasn't that long ago that I was in your shoes, but it has been a while. So I fell into dermatology when I first went into medical school. I thought I wanted to be a primary care doctor and really wanted that continuity with patients and really wanted to have that long-term relationship, and also really enjoyed having patients that were all ages. So for me, that was something that I was looking for. And then when I got into medical school rotations and started to actually do primary care, which was one of the required rotations in our 3rd year of medical school, I realized that I didn't like not knowing everything about something. So I was one of those people that felt like, well, but wait, what do you mean I have to hand somebody off? I need to figure that out. So I had to kind of rethink what I wanted to do, and fell into dermatology because I also really liked the surgical and the procedural type of activities that I was getting exposure to through general surgery rotations. And but also very quickly realized that I didn't want to be in the hospital. That was one of the things that for some people, they love it. They love that environment, and I did not. So for me, it was about finding where I was going to be happy and sustainable for a long time, and was lucky enough to find dermatology. As a dermatologist, I am a medical dermatologist. I don't do a lot of cosmetic work. A lot of people think most of our dermatologists now in the media is all about being the person who does a lot of cosmetic work. And for me, I do mostly medical dermatology. So that means that I take care of patients with rashes and acne and concerning skin lesions that are potentially skin cancers. We cut out both skin cancers and also sometimes benign lesions like cysts. You've all probably heard of Dr. Pimple Popper. And so we do a lot of cyst excisions if those are benign, or even benign moles that are bothering people. Dermatology is complicated. There's probably, I think the estimates is 2,000 different rashes that you could have. And so trying to visually see all of those different things to me is fascinating, because sometimes you can come in and know exactly what somebody has just by them walking in the door because it fits a very classic pattern. And sometimes you don't, and you have to take a small biopsy and find out for the patient. But it is something we can help with things that are very symptomatic or sometimes very bothersome to patients, whether it's itching or cosmetically bothersome to them because they've got red flaky rashes all over. And you can help them get better fairly quickly. Not always, but a lot of times. So it's very rewarding in that way. And I see little babies that are days old, sometimes with birthmarks. And I see my oldest patient right now is 104. And that's lovely to see somebody that's 104 be able to walk in your door and check in and talk to somebody that's lived that life. I see families. So I will see grandparents for their skin checks, and then parents when they have rashes, and then their kids for acne or warts or something that they have that is temporary. But I will have a good relationship with that family because I'm seeing lots of their family members throughout different stages of their life, which is lovely, because then you can have that continuity and know a little bit about them and what's going on in their lives. Trying to think of questions. How did the pandemic affect the field of dermatology? So we did try very shortly to do telehealth dermatology. And it works for things that are small or for follow-up of patients you know. I would say it actually was wonderful in that I now have an avenue to take care of some of my college students when they go away. If they're having if they're going to college in California, I can now still see them as patients and continue their acne care because we have teledermatology and Zoom visits still in place. But for general skin checks and for new things, it didn't work very well. So we kind of found the things that it worked well for and the things that it didn't work well for, and tried to get back up and running with patient care as quickly as we could. Let's see, the hardest part of getting into the position. So for me, I was a high achiever and I had done well in high school and in college. I worked really hard to try and keep my grades up because I did know I wanted to go to medical school. When I didn't get into dermatology in the match after medical school, that was probably for me one of the biggest times that I had actually been told, no, you're not good enough. And just being vulnerable, that was, it was pretty low because you kind of like, okay, now what do I do? And I had to sort of figure that out for myself. I had potential options of going back to, trying to get into a primary care residency that was easier to get into at that time, or other specialties that were easier to get into versus retrying, which is what I decided to do. And that was sort of, for me, a personal choice. Like, what is this important enough that I want to stay and fight for what I want to do? And it's hard sometimes when you are on this road. I know I have colleagues that didn't get into the school they wanted to for college, or didn't get into school they wanted to for medical school, or didn't get in the first time they applied. And I think that one of those things that you have to sort of dig deep and is find your resilience and find out for sure, this is that time where you kind of do your self-talk. Is this what I want? Is it something that I want to fight for? And for me, it was. Let's see. Did that answer your question, Jabez? Sorry if I pronounced your name wrong. Okay, perfect. Normal workday for dermatologist. I think dermatology is thought to be easy. We see a high number of patients. I see usually 26 to 30 patients a day. And so I work pretty steadily from 8 to 5 with patient care. I have an hour lunch. I do often answer messages and chart during my lunch hour and then after the day. So I usually get here just a little before 8, and then I try and head home before 6, and that's sort of my balance. But I definitely think that it can be more flexible if you want. I work in a group that has high demand, and so it's sort of my own limit that I'm setting on myself for how many patients I want to see. And that's sort of, I'm kind of at my max right now because we are short a dermatologist. So when I'm at a 30 patient day, that's a long day. But it's definitely busy. I think that's also nice. You don't have, the days go really fast because every person who walks in the door, is different, and you're just constantly moving through. But yeah, most of the time dermatologists aren't working on weekends, and most dermatologists don't take call in the hospital. I would say we are sort of a little bit of an exception in that we help our hospital. We're not officially on call, but we have a small medical group of about 150 clinicians, including our hospital team. And so they do call us occasionally to go over there and help them with a case. But most of our clinic, it's all clinic work, outpatient. Hours per week do I work? I work, right now, I work 3.5 days in clinic and 1 day doing my administrative work, which is the chief experience officer work. When I first started, I worked 4 days a week in clinic. And I would say a lot of clinicians right now are working 4 days a week. Favorite procedures. I would say probably scalp cysts are really fun because they come out really easily. So they come out together, which is just a fun procedure to do because you open it up and then you push on it and it pops out. So that's just a fun thing, but it's also fun to be able to cut out skin cancers. I mean, there's not many times when you tell people they have a cancer that you can then bring them back in that same week or the next week and cut it out. And then you can say, there you go, you're cancer free, no problems. So that's pretty cool too.
Oh, we have another question.
Courses. I mean, I think I was a science major, but I don't think you have to be a science major. If you, I think that's very true for medical school. You can be a different major. You just have to do all the extra requirements. I think physiology in general is helpful for almost everything in med school. So the anatomy and physiology type classes are probably the most helpful for dermatology per se. But I think also, and this probably goes for a lot of medicine, anything that you can do to help your understanding and interactions with patients. I would say psychology classes, sociology classes, you as a clinician or physician, no matter what field you go into, you will be spending time talking to a lot of people and being able to help understand where they come from and some of the things that may be driving how they're responding to you will help you be successful in that job. So if you can add some of those classes into your plan, I think it can be very helpful. And I'll give you an example. We have a lot of patients in dermatology that get sent to us for a rash. Sometimes there is a medical reason for their rash, but sometimes it is an underlying psychological issue, whether it's anxiety that is causing them to do some scratching, habit behavior type things. So sometimes I have to work with our behavioral health team. But if you don't understand that overlap, then you're going to miss some of those diagnoses and you won't be able to help the patients as well, because they're going to come to you because it looks like they have a rash. But that's part of that understanding the human as a whole being. So that understanding and classwork that you do, even though it might not be 100% part of your medical prereqs, is super helpful for actually being able to talk to people and help them through what's going on. Yeah, residency matching. So from the process for medical school and for people who want to be physicians. So most of the time, the track, and I'm going to say the traditional, is that people go through a 4-year medical school and then a 4-year undergraduate and then 4-year medical school. And there is also some combined programs where you can do a 6-year program where you get your undergraduate and your medical degree at the same time, but most people do a 4-year undergrad, 4-year medical school. After your medical school, you have to choose what you want to do with your career. And that's what they call your specialty. And that is where you are choosing to do extra learning in that area. And that's the residency training. So medical school gives you the basic knowledge. And then in residency, you get trained to be a specific type of physician. So a family practice doctor matches into a residency training. And that residency training can be anywhere in the United States and in different fields. And then you do your training there. So it varies on length. Some residencies are 3 years and some are longer. For dermatology, you are required to do a preliminary year where you do training in general medicine. So you could either do a family practice internship, or for me, I did an internal medicine internship. And then you do 3 years within your specialty. So it's 4 years total. And that match program is sort of like an application, but the whole group of all the medical students across the United States apply through the National Residency Matching Program. And then also people from abroad who have graduated from foreign medical schools can apply. And then you try and you pick your favorites and go for interviews, and then they pick their favorites and it sort of matches you where you go. Does that make sense? Okay. I know it sounds like a long process, but it's one step in the process.
I had a question. What can we all do to protect our skin?
Sunscreen. So sunscreen is definitely something that we as dermatologists all recommend. Hats, long sleeves. But yeah, sunscreens, and the sunscreens that have zinc or titanium, or if you have medium tone skin, some of the tinted ones with iron oxide work better. And what the goal is to protect the skin from extra UV radiation. And that not only protects you from skin cancers, but it also protects you from color changes that can happen from sun damage, and also increased aging and wrinkling of your skin. So the more sun protection you have, I tell little kids when I lecture to them, you guys are much older, but it is a good thing to remember. If your shadow is shorter than you are, you should stay in the shade. And that's basically avoiding those peak hours. When the sun is right overhead, that's really dangerous time for sun exposure. But that's just a little one to remember.
I'll tell my son that. He's in the pool, outdoors, doesn't matter what time. So always forgets.
Yeah, I mean, definitely sunscreens help for areas that are exposed. Hats and sun protective clothing for sure. But it does make a difference. And even for people, if you have relatives that are already having sunscreen, it can make a difference even if they've already had skin cancer. They actually did a big study related to that and showed that even if you started it when you were, in your 60s or 70s, it could help.
Okay. Are there any other questions for Dr. Carroll? All right. Well, I think that's everyone. So thank you for being on and sharing your specialty with us.
Of course. Yeah, and
I really
definitely
appreciate that.
Sam can get you in touch if you have anything specific that you wanted to ask about dermatology. I'm happy to share or the process. I know you've got lots of mentors through the SSVMS, but happy to connect with somebody if somebody has some specific questions.
Yeah, great. Well, thank you so much. Enjoy the rest of your afternoon. We really appreciate you being on.
Have a great day, everyone.
Okay, we'll give you guys a quick break. So be back here. Oh, actually, we'll have a few minutes, so you can be back here right at 11:30. Good morning.
Good morning.
All right, we're just getting back from a break, so we'll go ahead and get started.
Wonderful. Let me share my screen.
Okay. So our last speaker is Dr. Anamaria Robles. Dr. Robles is a trauma surgeon and intensivist at, I said that right? Intensivist at UC Davis. So welcome, Dr. Robles.
Thank you. Can people see you can see the wrong slide. One moment.
And we can't see anything yet.
Can we see the correct slide? No.
It's loading. Oh no, I see the Zoom workplace. Oh, there we go.
Can we see my slides?
Yeah.
Awesome. I'm Anamaria Robles. Thank you guys so much for being here today. I'm going to tell you a little bit about my journey to medicine and how I ended up in trauma surgery, and a little bit about some of the things that have motivated me. So this is more of a story of how I got here. So I was raised, let me just get my kicker going. I was raised in San Diego, California. I'm the oldest daughter of 2 kids in my family. My dad is an immigrant from Mexico. He came to the U.S. when he was 12 years old. He served in the Army and eventually settled in San Diego. My mom, as you can see, she's a white American. She's a daughter of like farmers from the Midwest, and they ended up in San Diego because they served in the Navy. Based on the stories that I hear kind of from my family, my parents did not have it easy when they got together, being from 2 different kind of racial ethnic group families. But I am really, really lucky because I've grown up in a very supporting family. I was the first in my family to go to college. I was the first in my family to go beyond college. And certainly, although we were not like rich in money or connections or pedigree, one of the strengths in my life has been the love and support of my family. And they're definitely the foundation for my success. So I'm going to tell you a little bit about how I ended up getting to become a trauma surgeon after growing up in San Diego. So I went to high school at San Diego High School. This is a large public high school in downtown San Diego. It's in San Diego considered overall a poorer inner city school. It was more than 70% Latino. It had a high dropout rate, like more than 50% of my class did not graduate. And despite this, I got a fantastic education there. I did really well in school. And I think one of the things about high school that was really hard for me was I felt that the environment had really low expectations for me because I was a young Mexican American woman. And it's really hard when people's expectations don't fit kind of where you are at. At the time, I thought I wanted to be a doctor, but I had no idea really how to get there. And I really wasn't sure what I was going to do. But I knew I wanted to go to college. I knew I wanted to move away and get some space and kind of figure out who I was. So I was fortunate to have lots of good options, lots of help when applying. I chose to go to UC Berkeley for my undergraduate education. And I majored in biology there. And I won't lie to you, Berkeley was hard. It is a big competitive school. And I sometimes got lost there because there was lots of decisions, like what classes and what majors and what extracurriculars and what financial aids that really my family and friends couldn't help with because they didn't know that experience. And I often felt it was really hard to see other people with a lot more resources and self-confidence than I had. A lot of times I thought I wasn't good enough to be there. And a lot of people would tell you you're not ready because of all these low expectations. But it took me a while to realize I was ready, that I could do it. And I learned how to build a community. Every college has this. They have mentors and places that can kind of help you navigate it. But you do have to really find them and kind of hang on. Without those people, I never would have made it through college. But lots of people do want to help you and they want you to be successful. So I think that was one of the great things about UC Berkeley. After Berkeley, I was like, I still think I want to be a doctor, but I still had never really worked with doctors or met other doctors. So I got a job then working at Oakland Children's Hospital. I was a research coordinator. This gave me exposure to like what a doctor's life was like. It helped me earn money to study for the MCAT. I worked that job for 2 years and then I applied and I got into med school. So if you want to see how long it takes to be a trauma surgeon, it's a long time. So I went to high school, that was 4 years. Then I went to college at Berkeley where I got my degree in biology. That was another 4 years. Then I went to UCSF for medical school, which is another 4 years. So in med school, you take a bunch of tests so you can get your MD. And then you figure out what kind of doctor you want to be. I eventually figured out there that I wanted to be a surgeon. So then you apply to this thing called the match, which like tells you where you're going to go in your last year of medical school. And there I matched at UCSF in general surgery residency. Now residency in surgery is longer than residency for other types of medicine. At UCSF, it's 7 years, including your intern year. So for that, I had 5 clinical years and 2 research years. After that, I decided I still wanted more. So this is actually how I ended up in Sacramento. I applied for fellowship, and this is in trauma and surgical critical care. So that's when I matched here at UC Davis. That's when I moved out to Sacramento. This was in 2020. I finished all of my training in 2022. So it was about 20 years or so of training to get there. And it was really a wonderful experience throughout. But that's some of the process that I took to get to becoming a trauma surgeon. After fellowship, I stayed here, and I'm now on faculty here at UC Davis. So it took about 20 years, but definitely well worth it, especially when you think about what you got to be able to do afterwards. So some of the things that when I talk to different groups, I talk about, it's like, well, why would you want to work in healthcare? It's definitely really hard. And some people, including my parents, might say, like, why in the world would anybody work in health? You know, sometimes I wonder that too. But I think it is a vocation for me and a lot of other people for a lot of reasons. I think the human body is one of the coolest things in the world. And I also really believe in service, and I believe in social justice, and I believe in taking care of people and helping people, and particularly in trauma surgery. And when I'm in the ICU, you know, you get to be there for people at the worst times in their lives. It's a real privilege and honor, and people let you into their lives in a really real way, and you get to help them through their most difficult hours. And I think that is one of the truly unique things about being in trauma surgery that can't be replicated anywhere else. When you think about how did I choose surgery? Well, I started and I wanted to be an obstetrician. I went into med school thinking that would be my path. Like I said, I believe very strongly in social justice. I believe a lot in women's rights. I thought that would be a good way to channel that. But then I did my rotation in trauma surgery, and it totally changed my life. It's super exciting. I love the idea that you can take care of anybody who walks or rolls in the door, and with whatever type of problem they have. And I really enjoy, although it stresses me out sometimes, not knowing what the day is going to bring me, but it also gives me the chance to really feel like I'm serving my community. A lot of our patients in the trauma population are underserved, and it's the first time, particularly when I was rotating in med school, that I felt like I was really serving my people. So that's kind of how I ended up in trauma surgery. When you think about my day-to-day life, it changes a lot based on where I am. So when I'm on trauma, we meet as a big team on trauma or on general surgery. We talk about all the patients. And when I'm on service, we talk about everybody that's come in the 24 hours before, what their plans are going to be. And then during the day, we kind of go through and see all the patients that are in the hospital, and then we run off to traumas. So basically, I'm walking around the hospital seeing patients that have been admitted after they're hurt, but at any point I can get called on the phone by another hospital that's saying like, oh, hey, we're from 200 miles away and this person's really hurt and we need to send them to you, because we take care of everybody that's very, very injured at UC Davis. Or I can get called down to the trauma bay by the emergency department, and they'll say there's a trauma coming in, and we kind of stop everything that we're doing. We gather as a big team of doctors and therapists and nurses, and the teams get bigger based on how sick somebody is. And then we trickily try to figure out, when a trauma patient comes in, what's wrong with them, what's hurt, who needs surgery. If they need surgery for things like bleeding, I will often take them to the operating room. I can explore their chest or their abdomen, and I get to work with tons of other doctors. Neurosurgeons, face doctors, ENTs, plastic surgeons, orthopedic surgeons, vascular surgeons. All of us try to help people after they're hurt figure out how to take care of them. And here at UC Davis, I get to take care of people from all over Northern California and that are hurt in lots of different ways. What that means is they can be hurt from being shot or stabbed, they can be run over by a car, they can be in a car crash, or they can be sort of other weirder things like you fell off a fence, or you fell off the monkey bars, or you fell off a highway, or all kinds of other stuff. Anything you can imagine, we've seen it. And that's part of what I think makes my job really interesting. Some of the challenges that I have encountered in kind of the process of becoming a healthcare professional and becoming a surgeon is it's hard. You know, it takes a long time. You can see it's taken me years, and there's a lot of hurdles to jump through. You know, there's always another test. There's always more schooling. There's always more applications. Still to this day, there's more applications and more things, and this kind of happens over and over again. And to a large degree, I think any job in healthcare, whether you're a therapist or a nurse or a doctor or really anything, you have to love it because when you study, it's got to be the thing that's motivating you to take better care of your patients every day. You know, that's the thing that when I'm reading new literature, I'm learning about new techniques, you're motivated to stay up late and to work on these things because you want to be a better doctor. You want to take better care of these people. The hours are definitely long. It is not as glamorous of a job as it is on television. And I have personally, and I think it's worth saying, it's hard sometimes to feel like you belong in this job, you know, especially if your background is different than a lot of the people that you train with. And I was saying nobody in my family really understands what I'm doing or what I want to do, but it has never once stopped them from fully and wholeheartedly supporting me and being my biggest sort of cheerleaders. But sort of knowing and understanding that at any stage, my family's like, okay, Mija, good for you. You know, like they'll never quite fully get it, but it does not stop them from being the people that have helped me get there to where I am. So I would say my family, the people that have trained me, these are the people that have inspired me most to be who I am. And my other most inspiring person is, I'm now a mom. I had, in fellowship, I'm trying to show you my baby. I had a very sweet baby. I now have 2 babies. And I think having my daughter trying to be the best person and the best mother that I am in kind of all facets of my life has been one of the greatest challenges. And I hope that she's super proud of her mom because it takes me away from her a lot. But these are the things that can definitely help keep you motivated, especially if you are in medicine, because medicine can get tough, but having a loving family that helps and supports you is very important. So that is like a brief whirlwind about my job and about surgery. I'd love to hear questions, comments. What things do you want to know about what it's like being a trauma surgeon? Let me bring up the chat. I got one. Okay, perfect. Because I feel like people always have questions, so I want to leave a lot of questions and time, and I'm happy to talk more about it. Okay, first question. During any surgery, what are the biggest challenges, personal or from your team, while performing surgery on any patient? And it's an amazing job that I've got to learn. So I think it depends for me as a trauma surgeon. Sometimes the biggest challenges is when our patients are really unstable. What that means is they're really sick. So we have to move pretty quickly, and it can be a challenging time in the room because, you know, everybody is nervous, everybody's trying to move quickly, everybody's trying to take care of them. Different than like if you come in for an elective surgery, which is also part of surgery. There's lots of different types, right? So an elective surgery, like, oh, I need to get my gallbladder taken out, but I know I'm going to do it. I show up or I get my knee replaced, right? Those are elective surgeries. Those tend to have a different, they're not as sort of pressured because it's not like, oh man, this person was in a car crash and it's bleeding from their liver and we need to stop the bleeding right now. So that part I think is the biggest challenge, is knowing that somebody's sick and you need to move very quickly and you don't know what's wrong with them, but you got to figure it out really fast. So I think that is when everybody working together can have the best impact on helping hopefully save people's lives. Okay, as a trauma surgeon, how do you deal with the emotional reactions you have to the conditions you see? And then what does flexibility look like as a surgeon? Do you have set days or shifts? Yes. Great questions. Emotional reactions to the conditions. This is hard in any type of medicine, right? Because lots and lots of parts of medicine, there's a real emotional reaction that we have to them, and that's normal, right? We can't stop from being people. And I think part of being a person and not a robot is like, that's part of what makes us good doctors and good physicians. Things that I do to deal with emotional cases or difficult cases. I talk to my partners. I have wonderful partners. We're a group of 20 people that are a mix of civilian and Air Force, and we work in trauma surgery here. And nobody, you know, knows it the same way that your partners do because you walk through it together. So we talk about with our partners and particularly difficult situations. We'll do debriefs as a team where we'll talk about, okay, like this is what we think went well. This is what we need to work on. And really, I try with any difficult situation that I have to always think about, if I couldn't save someone, how can I use what I learned to do better in the future? And we're always learning all the time, especially in medicine. I think if you don't want to learn every single day, then it's probably not the job for you. But if you're always interested in learning and getting better, that can be a huge motivator for surgery. Flexibility look like for a surgeon. So it's different depending on what kind of surgery you do. For me, I'm a trauma surgeon, so there's more sort of set days and shifts, but I don't know what's going to happen. You want to be like a surgical oncologist that takes out cancer. That schedule is going to look super different. But for me, I work in kind of weeks at a time and nights on call. So I'll do a week in the ICU, which is our surgical ICU, a week on the trauma service, a week on the emergency surgery service. I do about 2 weeks a month, and then I do about 4 night shifts on one of those things. And on the night shifts, and on the trauma services, you're taking care of everybody who comes in, operating on people that need operations. The other days, I'm able to do my admin stuff, like meet with you guys, which is what I'm doing today, and see patients and those kinds of things. So I work a lot of weekends, I work a lot of nights. That's part of being a trauma doctor. And if that is not what you like, there are certainly other types of surgery where it's more of a like 9-to-5 type of job. How do I balance my life, particularly since it takes a long time to become a trauma surgeon? It is a challenge. I think any job, though, whether you're a trauma surgeon or you're not, like it's always hard. We're always in search of better balance. That is, I think, just piece and parcel with doing the job. I'll say right now, I'm the mom of 2 young kids. I have a 3-year-old and I have a 9-month-old. So my life is not very balanced. I do work and I am a mom, and those are the 2 big things. But there's a season for everything, right? My kids will be bigger someday and they'll need less of me, but right now they need a lot of me. And that's okay. I love those jobs. So I think balance looks different at every stage. When I was in training, I didn't have kids, so I was really, really focused on being in the hospital all of the time. And that's what I needed. That was my kind of balance. Things that help me is making sure to like try to sleep enough and to try to work out and all of those things. Because when you work a lot of night shifts, you have to take care of yourself so that you know, at 2 a.m. when you need to make a snap decision that's going to save someone's life, you're thinking as clearly as you can and you're taking really good care of them. So you need to do a good job in kind of as much as you can in the other parts of your life to really take care of them. What is the difference between trauma and emergency surgery? Great question. I do 2 different jobs that might answer this question. So I do the trauma job, which is where I take care of injured patients, and that's like run over by a car, falling off of things, shot, stabbed. That's like injury, anybody that has some form of an injury. Emergency surgery is another part of my job. We call it emergency general surgery or acute care surgery. And that's a different service that I also help on, and I also take overnight call on. And what that means is anybody that has an urgent problem, right? You go to the emergency room because your belly hurts and your appendix is infected. Like I would take care of you. I would help take out your appendix or your gallbladder. Or maybe some of your parents have like diverticulitis, like, or your bowel hurt. Those people are people that I take care of in the hospital under emergency surgery. So emergency surgery is people that need urgent surgery, usually in their bellies would come to me. Trauma is people who are injured. Not all trauma patients need surgery, but trauma surgeons take care of them whether they get surgery or not. Because we know how to take care of, you know, if you're bleeding from your liver, but I'm not going to take it out, but I'm going to monitor the bleeding, that's still my job because I'm somebody that is trained and practiced and read and an expert in how to take care of injured patients. So that's what I do. And here at UC Davis, I take care of injured kids and injured adults. So it's really the injury thing that lands you kind of in my clause or in my hospital. Other questions you guys have? These are great questions. Oh, what's a case that really stuck with you? There's lots of them that really stick. I think some of the harder cases, well, I can think of one. A couple months ago, we had a young man that was shot, and he came in the belly, and he came in super, super sick and super injured. And I was on by myself, and I called in one of my partners who drove in as backup, and he helped me. And this guy was like, there's a part of the body that's like the surgical sole, and that's where he was shot, which is kind of, we call it the right upper quadrant, where he hurt like all the things that possibly could have been hurt there, like all the different organ systems. And he was really, really sick, and I was worried that he was going to die. And we actually then called in my boss because we were working and we couldn't get control of the bleeding. And eventually we did enough And then we work as a group here. So, I'm on for a week. I take care of people. I hand it off to the next person. They keep taking care of it. And it really stuck with me. I got to take care of him. He's still in the ICU. He's still sick, but he's alive. And I got to talk with him and tell him like I was here when he came in. And it's just remarkable sometimes when you have people that are really, they come in very, very sick, when you're able to get them through, even if they're with you for a long time after. It's grateful to be able to see them with their families, because it helps make all the very long hours feel worthwhile. Other things I can tell you guys about. Great question, Sam. Anything with kids. I hate it when kids get hurt. Everybody hates it when kids get hurt, but it's an important job.
How do you keep up with what, the new technology that comes up, the new
Yeah,
I mean, how do you keep up? It took you all that schooling, but how do you keep up with what's happening now?
absolutely. Great question. There's some of it you kind of pick areas that you are focused on, that you're like your group's expert in. Like some of us are focusing more in surgical robotics, which is like this really cool method of where you actually sit and run a robot while you're doing the surgery. Like the person runs the robot, but it's super awesome. A couple of my partners do a lot of like rib plating, where when you break ribs, they'll like reconstruct all of your ribs together with like plates. For me, I've taken on some roles in the ICU, so I am always reading and getting updates and alerts and listservs and conversations and discussions with other ICU doctors about how do we take better care of our injured patients in the ICU. So it's like a combination of talking to people, getting lots of emails, like lots and lots of emails online, of all like the latest things, and then trying to make sure that because in my job here at UC Davis, I spend a lot of time teaching people. So I teach fellows, people that were like me, and I also teach residents in surgery, in trauma, in ICU care. And that's the whole part of teaching, where I help organize classes and I make sure they're reading the articles, and we do evaluations and we do testing. And that's part of what being an academic surgeon is like. You're not just operating, but you're spending a lot of time to teach kind of the new generation of surgeons as they turn over. So that's the other thing that I think is really unique about being at UC Davis, at least. And you can definitely have jobs where all you do is kind of operate and take care of people. But for a lot of our big trauma centers, those are at universities. And part of our job at universities is teaching our medical students and our residents and our fellows and kind of our nurses and everybody else that comes through. So that's definitely one of the awesome parts of my job. We get new interns, I think, in like 4 days, and those people have never been doctors before, and then we're gonna like hand them the pager and we're like, here you go, good luck. And it's like a huge amount of learning all at one time. And it's really wonderful to see them do well. And then the people that are graduating and moving on and going on to work in their jobs are also doing great. Oh, good question. What qualities should surgeons have to be successful in their field? I think one of the best parts about surgery, and I think one of the best things about medicine, is that we need lots of different types of doctors, right? We need people that are really good at talking to folks, right? In psychiatry and in a lot of times in primary care, we need people that are really good at talking to people, really good at maybe convincing them to take their medicine, that are really compassionate and empathetic. We need people that are super smart in engineering and in people that are very good with their hand-eye coordination, which is something you see a lot in surgery. We need lots of different types of people. Some of the best physicians I know are not very good at talking to others, but they're great surgeons, or they're great radiologists, or they can figure stuff out. There's lots of different types of people in surgery or in medicine that we need. For surgery specifically, I think a lot of us are, usually pretty driven and dedicated because it takes a long time. Sometimes we're not the best bedside manner. Most of us are pretty good these days. There's this kind of archetype, like an old school sort of ethos of it being like, oh, the surgeons are not very good. But that is not generally true these days. And most of us are pretty good at talking to people. You have to have pretty good spatial awareness and hand-eye coordination, because a lot of surgery is throwing, suturing, tying, cutting, making sure that you can be creative and kind of piece things together. And that you can, sew something with appropriate tension and sew two pieces of bowel together in such a way that it doesn't leak, or run the robot taking out somebody's cancer, right? You're taking out a pancreas cancer, so you need to have really good hand-eye coordination and then kind of fine motor skills. So I think those things are very important, but also having, like in a lot of parts of medicine, good judgment, good people skills, being able to talk to other folks. And I think for surgeons at an academic place, you need to be a good teacher. You need to figure out ways how to teach other people how to do things. This is how you sew, this is how you tie, and give them, we talk about graded responsibility. That's why it's a long training program. So in the beginning, somebody's showing you how to do it, then you're watching them do it themselves and giving tips, and then you're really letting them do stuff more independently. So as somebody progresses in their independence and their knowledge and in their skills, like their technical skills in surgery, you give them more independence to figure out, what they know how to do, how they do it. Are they ready to go out into practice? So that's what we do in med surgery. But I think we don't just need surgeons, we need lots of different types of doctors in lots of different types of ways, whether it be radiology or pediatrics or OB-GYN or I'm thinking of some of the other big ones, internal medicine, that kind of thing. Different things for different surgeons. General surgeons is what I do, and it's more you can make quick decisions because you're in trauma. Some people are more technically based. Neurosurgeons are very technically based. Ear, nose, and throat doctors, plastic surgeons that do lots of sewing under a big microscope. That is not what I do. Orthopedic surgeons, we make fun of them because they're like the jocks of surgery. With them, it's a lot of drills and plates and kind of bigger motor things to kind of pulling the bones back together and screwing in plates to get them in. So even in surgery, lots of different types of people that we need, which is part of what I love about it. If I wasn't a surgeon, what would I go into and why? Great question. Still probably OB-GYN. I think I would be good at delivering babies. I thought it was super fun. It is, I just found it really stressful. In a way, I don't know, I'm a trauma surgeon. So it's funny the things that you think are stressful, right? But I thought that was like a really magical, awesome thing. And then you also, like in my job, you get to be there for people at different times in their lives and be there for them at really important times in their lives. So I think that would be a really fun field. And if not that, I don't know, maybe interventional radiology. I kind of like looking at pictures and sitting in a dark room, and I think that would be kind of peaceful sometimes. But there's also like lots of different types of surgery that I thought about when I was getting ready. But I like trauma. It's a fun field. It's always evolving. It looks different now than it did 20 years ago, and in 20 years, I think it's going to look really different as well. But hopefully we can keep evolving and changing with it. Other questions? Thank you guys for listening. I hope it was interesting.
Oh, that's great. Thank you so much for sharing. We really appreciate it. This is one of my favorite topics. I love learning. I love your pictures. I love all your pictures.
I got to put the other baby in there. She'll be mad.
So thank you very much for
Thank
joining
you.
us.
Thank you for listening. Thank you guys for being here and for being interested in medicine. We need lots of good doctors and therapists and nurses coming through. It can't all be me. I'm going to retire someday.
Well, enjoy the rest of your afternoon, and thank you again. All right, guys, that concludes our day. The winner of the gift card is Jabez Lim. So I will email you your gift card. All right, I think that's it for today. So we'll see you again on Wednesday at 10 a.m. Have a good afternoon, everyone.